Laurencekirk is a small town, which was the market town of the area at one point, and about 7 or 8 other villages round about.
It began 8 years ago, and it began after a series of interviews with older people, things that they wanted in their communities that weren't happening for them.
My team's responsibility on behalf of the council is to work with young people, adults, community groups to improve the quality of life. We looked at how we could address issues for older people by involving older people themselves. So, put a bid into the National Lottery for their Healthy Living Network funding, and were successful. So the Mearns Area Partnership, which is a collective body, bid for that money. The bid crucially involves some funding for a development worker, and that's where Ed comes in.
I think we've been successful as an organisation, partly because the amount of community involvement, particularly the involvement of older people at all levels of the organisation in terms of the management, volunteers. The second reason we've been successful is the really good working relationship we've had with key partners, particularly community learning, social work and the local health teams.
The secret of our organisation, it is run by older people, for older people.
We also ran lots of kind of group activities, such as lunch clubs, exercise groups, computer classes, and other social activities, and we ran a group for people with dementia as well.
If we can find a need and establish a need, then we try to set it up.
So the biggest thing for me is that they've actually got in existence a model that allows older people to tackle issues themselves.
The lunch clubs are very successful, and they're run in every group, every village has its own lunch club. And speaking to older people, when I go to a lunch club, I find that the food is secondary. It's the fact that they've got a purpose to get up and go out.
But I think it's a social thing of our age group. That's the thing. Get out your house and join in.
The intergenerational project is happening in each of the primary schools in the cluster network. The idea was to provide an opportunity for older people to come together to learn about something that happened to be ICT, and we used the skills of the primary 7 pupils to do that. So we paired up the primary 7 pupils with older people who might have been parents, grandparents or individuals living in the community.
Well, I think they want everybody of my age, and younger of course, to be able to use a computer.
We chose IT because we thought that would be a good way of capturing people's imagination, getting people in, and because of the skills that the primary school children have, they've grown up with that and they're used to that. So it was a good way of linking the two.
And then we have been down at the school. Primary 7 was showing us how to use this. So I thought, time I had one of my own. So I've got one. So I've said to my son, who put it all up for me, I'll send you an email every night. Hope you get it.
The awareness of Mearns and Coastal Healthy Living Network has really increased through this, and we've reached a lot of people that may not have otherwise. It's worked, and you can see the benefits straight away.
The feedback overwhelmingly from older people is that this benefits them, it increases the quality of life, and the feedback from professionals, health professionals and so on, is that it makes their job more effective. If you've got a bank of 50 volunteers involved in running a range of services, using social return on investment, you can look at the benefit that brings, the cost reduction in that you're not passing on dependency for services to health professionals in the future.
And partly that is about calculating volunteers' time, but it's also about putting a price on, for example, if someone gets their shopping done, partly what that saves social work and home care services, what that saves families and so on. And it tries to build up a total picture of the financial as well as the kind of social impact that we're having.
It's a fairly new way of doing that, but it's highly valuable to the voluntary sector because it places a value that hasn't been captured before.
I mean, the value of organisations such as CHEX and other national intermediary organisations, I mean, I think certainly in terms of having the kind of knowledge and experience of working at a national strategic level is really important.
The members of the Mearns and Coastal Healthy Living Network value their work being recognised through a national organisation, and also it makes it much easier to share best practice.
CHEX is very important because they help us and support us, and they have supported us in the past.
CHEX is shorthand for the Community Health Exchange, and we're part of the Scottish Community Development Centre based in Glasgow, but we have a national remit, and we're primarily funded by NHS Health Scotland to support community health projects. But these are projects that are community led, and that sounds a bit jargony, but it's very important because it means that these organisations are working directly with communities, with community members, finding out what their issues are, what their problems are, and working alongside them to actually do something effective that will make a real benefit to their lives as individuals, but also that of the wider community.
So in terms of Laurencekirk and Butte HLC, they would have come along to a lot of the kind of national conferences that we've run, and certainly we've asked Ed to have an input into many of the kind of seminars that we've run as well. So for example, Ed's doing a lot of work around about social auditing, and so some of the themes in our seminars were around about how to impact your work in a sort of financial terms, and that's where social auditing has come in. So Ed has had an impact in terms of giving us an input on how they actually do that and the work in that.
Where there's a demand for evidence from national policymakers and local policymakers as well to evidence the work that people are doing, to look at the impact that's actually making. So community groups can't rely anymore on anecdotal information, they need to do research. And we have supported a range of community groups on what we call, a bit of jargon again, community-led research. But that's again working with organisations on the questions that they want to ask about the issue that they're concerned about. And we will support them to develop these questions, go out and gather the data, analyse the data, and then assimilate the information that they can then take on to policymakers.